We're recording now.
We are.
You've been on camera a ton. So I should introduce myself with this recording thing, right? I'm not good on camera. I'm Janae from the Sharp Index, and I'm sitting down today to talk about physician burnout, I guess. And you've been on camera for a bunch of things. You want to introduce yourself? Sorry.
Should I introduce myself?
I mean, it's like our little YouTube channel, right?
Sure,
People know who you are. You don't need an introduction.
I'm Lakshman Swamy. I am an ICU doctor in Boston. I work at Cambridge Health Alliance and Boston Medical Center. And I also, during my fellowship, did a good bit of research on ICU burnout, especially in nurses. And that was before the pandemic. So since then, I've done some work, sort of academic work on COVID stuff and clinical work on COVID stuff. And then
sort of that type of work happening.
Yeah.
Well, interesting, because I met you before all this, and we had discussed we discussed your work, because it's fascinating. Yeah. I think especially now, have you guys had a lot of nurses leave, or I don't know if you're allowed to say that with your job?
Yeah, no. I think fortunately I have not seen a lot of nurses leave, although a lot of my friends who are nurses, I mean, I know some that have left, certainly. Some have kind of transitioned to doing like part-time ICU nursing, part-time other stuff. Some of them are getting like in DNP programs or something. So I am seeing kind of a good bit of movement out of the ICU, but that's always a little bit the case. ICU nursing is pretty intense, I think. Yeah. I don't want to just speak for nurses, but I think that there are a lot of people who, it seems like, spend some years in the ICU, gain a lot of experience, and then kind of move on and do other things. So I don't know how much more it is than usual here, but I can tell you, I was talking to a nurse the other day who said that she was getting all kinds of requests, offers to come and do shifts down in heavily hit COVID areas, and her exact words were, "You could never pay me enough to go back to that."
Oh, really?
Yeah. So I think that
there's having shortages in areas. I don't know which areas are the worst for COVID right now.
I think that it sure seems like there's a lot of states that have lower vaccination rates are seeing many, many more. They're seeing surges again, like real surges. I have colleagues that say it feels like we're back to March of 2020 here, where the hospital's really, not doing any elective, if you want to call it that, operations, and all the hospital's kind of shut down and just doing COVID. And that's really is like hell. It's really awful. It's just, I can see why that nurse said that, because it is so miserable to be in that world. It's amazing, because all the things that we used to talk about and think about for ICU burnout was already a thing, like a third or so of nurses, probably around that much of ICU doctors burnt out, probably a combination of things relating to some amount of sort of moral distress and providing care that feels a lot like you're providing suffering, along with really a lot of systems issues and how hard it is to do things, and all the paperwork and that kind of stuff, the stuff that makes it hard to do the work, to deliver care, to be caring. And then I think also, and this is what my research was focusing on, was kind of the workplace climate in ICUs, and how different your experience can be depending on what the climate is like in different ICUs. I think I've been fortunate to be in ICUs that have, I think, really good climate, although, to be fair, you kind of really want to assess that globally, because that might be my perspective as a doctor. That's not necessarily the same as
the nurses might hate you. It's fine. Yeah. We'll find out if they watch the video. They'll be like, I don't know about that.
Yeah. No, I think but then that was all before COVID, right? And then once that happened, it really turned everything sideways and upside down in kind of a really awful way. I think that's what really hit me the hardest, was, in a way, It was just this
You
feeling
post about
that,
it, like how people are quiet, like how everything's quiet and
yeah, yeah. You know, the ICU is it's not a chaotic place. It's not like the ED where people are just coming in with anything can happen at any time. And I really respect ED clinicians for that stuff. But for us, it's very different. We have the benefit, the privilege of kind of maintaining order and controlling that chaos, right? We bring someone up from the ED from the floor, and we are there. We are trying our best to not have any surprises, right? We're trying to control everything to get people better. It's
like the ideal personality type for an unknown illness. If I could think of anything better, the
exactly.
control freaks, like let's put them in charge. Like,
yeah.
what could go wrong?
So it was exactly like you're saying. It was hard because we are so meticulous. We do things carefully and slowly, and we control our environment, control what's happening. And we lost all of that with the first surge because we had no idea what was happening, what PPE we needed, didn't need. It was just wild. The kinds of things we were doing was changing every day, and people were so sick. And there were lots of surprises in the bad way, where people were developing complications at just way higher rates than we had ever seen before, on the ventilator and all this stuff, because they were so sick. They were so sick. And so that was miserable. And it really changed things, because the ICU, which used to be this place full of families and full of life and full of colleagues and everything, there was a really good piece that one of an intensivist up in Ann Arbor wrote, where it just kind of said what we were all thinking about. We know all the consultants that didn't show up, right? We know all the doctors that weren't coming in and were doing everything virtually while we were in the ICU,
Physician consultants, you mean? Or
yeah. Like the tests that we couldn't get done, the people who weren't coming to see the patient because of COVID. And that really hit us, because here we are, we have to be here, we're doing this, and we are limited in our ability to get things done and take care of these people. So we were, there was this everything was turned upside down, right? Where we used to have these incredibly warm relationships with everyone in the ICU, with our teammates, with our colleagues, with everyone. It really changed, where not only were a lot less staff were there at all, people were frazzled, of course, were scared, were stressed out. We were also scared of each other. I remember being so scared that I would get someone sick, or that they would get me sick, and I would take it home to my kids. So there was a lot of there was social distancing. Sorry?
I remember that, like the people posting about being scared, and like with the kids, and like, what do you do? And
yeah, exactly. And so that fear led to, we had social distancing, and there was also like emotional distancing that went with it, right? Because we were just like in our little worlds and trying to be really minimal interaction with other people. So it was just miserable. And that was a terrible time. I remember it. And I remember it too well. But the worst part of it was really the families weren't there. That was far and away the worst part, because it said everything to me when our waiting rooms, our family meeting rooms, were turned into workrooms for extra ICU teams. That kind of just encapsulates everything about that world, right? The families are gone, and in fact, there's just so many patients that we have to bring in extra surge teams and stuff. So,
but you're saying there isn't. You guys are having lower cases, right? Like, so. Maybe this is a dumb thing to say. I'm probably going to reveal I'm dumb. Don't care. Spoiler alert. I don't know everything. Okay, but aren't we having rates that are just as high now?
It's different everywhere, right? So what I'm seeing in the hospitals I work at here in Boston are unvaccinated people who are coming in with COVID again.
Right.
But nothing like the numbers that we saw with the previous surges. It's not a surge. It's just, it feels like the case numbers are going up. So maybe it's coming, but people haven't been sick in the same degree. And I haven't seen anyone who's vaccinated who's actually sick. I know my colleagues across the country are seeing that, but I definitely haven't.
You mean in the ICU?
Yeah. I know people who are vaccinated who were tested positive. Let's say they were asymptomatic. There's certainly people who got sick, but that's not my world is not that. That's not the predominant feature of it.
Right.
I see is very, like, not many, but some unvaccinated people who are the same as they were in the spring, although now we know a lot more about what to do and all that. So, it's really weird with a COVID patient, because before they get intubated and get that sick, there's not that much that you do. They're just sitting there on high flow oxygen, getting tons of oxygen. And we're trying to do little things and make sure that they don't get complications and all that. But it's weird. You're just kind of watching them, sometimes in the ICU, sometimes not in the ICU. Then the second they get really sick and they get intubated, and everything just gets so bad so fast, just the same as it was last year, because they're unvaccinated. It really is the same thing as last year, right? So that's miserable. And it's amazing because we have one patient like that, just one patient like that, and your whole world, your whole day is just so no other one patient dominates your day like that does, And to think, like, we used to have so many, that's what our colleagues are
because they
right
crash so fast. I guess I don't know.
It requires so much work and attention because they're so sick,
Right.
One sick COVID patient on the vent is probably in most cases your sickest patient. So when they're all like that, it's awful. That's what they mean when that nurse said, "That's hell and I never want to go back there." It's just awful. And it's, how those people don't get better, right?
What was that?
How those people don't get better. And it's heartbreaking because now it's kind of like, you could have gotten vaccinated, you didn't get vaccinated, now it's too late, and your family members are asking what's happening, and we're talking to them, you're telling your family members to go get vaccinated, and they're doing it, and that's good, but it doesn't help you, and everyone is just mourning.
I feel like some of the strangest part of the last little while for me has been, like, I lived in a place where it was pretty politically charged, but also the hospitals didn't get as overloaded as some areas in Utah. Originally, they weren't projected to get overloaded at all. And I think they might be at capacity now. But I have friends, who don't believe in masks. They are, they're not vaccinating. They think there hasn't been enough research. So, like, and then there's, like, the healthcare side. I feel like there are two parts of my world, the neighborhood moms and, like, and the healthcare people, and I wonder if a lot of people, physicians, probably feel that too, where they're like two worlds, like, and they aren't working together right now, like, at all. Like, I feel like it's super overwhelming, like, and you have to pick which one.
I think that's totally true. And it's amazing. You can see how big that gap is, because many of the unvaccinated people that I see that are not that sick, that when they come in for some other reason, they don't have COVID and they're coming in for something else, they pretty much, many of them within a few minutes of talking to me are ready to get vaccinated. They get vaccinated in the hospital. So it's really that tells me that there's a huge gap in, those people aren't out there burning masks, right? Those aren't these, like, hardcore anti-vax people.
Right.
I'm not saying, I don't know what the split is of those groups, but I know not everyone is like that who's not vaccinated. And it just shows how much, if we could get to people, not get them to us, but get to them, it really goes a long way in saying, hey, no, let me address what you're thinking about, what you're scared about, and it's safe and you should do it. And they all are kind of like, this is the first time a doctor has talked to me about it. And,
right.
And then, everyone's like, why didn't they call their primary care doctor? And I mean, it takes a lot. It's a lot of privilege to have a primary care doctor that you can call and to be able to reach them and to have a relationship with them. That's privilege.
Yeah, where they actually would talk to you.
Yeah. It's not easy to make that happen.
I feel like I could call my kid's pediatrician.
Yeah.
Also, I moved, so I don't know what to think about the divide stuff. And I mean, anecdotally, it's hard for everyone. I think it's not going to be great for physician mental health.
Yeah. it's hard because I think that we've never felt like this before, I don't think, where there's a real chunk of the population that not only distrusts us, but thinks that we are actively not working in their best interests. I mean, there's the people think that we are somehow getting like making money off of vaccinations or something. No, if anything, it costs us money to spend the extra time to get you vaccinated, to talk to you about it. You know, there's no benefit here.
I think this is kind of like a lose-lose for a lot of people. And then a
Yeah.
lot of people who were vaccinated, it's like, wait, can we just be done?
Can we just be done? Like, why are we not done? And there's a lot of
They're like, hey, we
resentment,
broke up
right?
when we got our vaccine. Like,
Yeah.
why are we still meeting?
I know. And it's also it's awkward because the messaging, you know, this is a real thing and it changes, it's dynamic, it changes month to month. And now with Delta, I mean, I think that pre-Delta, I felt like I was wearing like a suit of armor from my vaccines.
Yeah.
And now it's kind of like, it's a bulletproof vest, maybe. It's not like, I don't know, it's not as perfect. It's still huge, but it's not as perfect as maybe I was before. And so I'm doing all this stuff. I know I'm masking indoors and all that stuff. And I'm using the over-the-counter tests. And, you know, I've advised a number of family and friends who are gathering, all vaccinated, they ask me like, you know, is this safe? Which I do. I'm like, well, you're all vaccinated. You can't hole up and not do things. This is our world now. But go use those tests and just at least that's something, because you're traveling, and try to limit your exposure, wear masks, all that stuff. And in two separate instances, people did that testing and someone tested positive and it was canceled. So, I mean, there's vaccinated
wild,
people.
you
So
know?
it's just, people really expect more concrete, black and white kind of, you got vaccinated, therefore you're good. Well, you got vaccinated, that's really, really good, but it's not perfect. And it's less perfect than it was before. Asymptomatic, they were asymptomatic,
Oh,
they're fine,
you mean
right?
it's less perfect than it was before because of Delta, or just?
Because of Delta, yeah.
Yeah.
And that's the new kind of baseline, right? You don't go backwards. Delta is the new dominant strain, and the next one hopefully doesn't come, but if there's another one, it'll be worse. So it's like, you know, so it's hard to message that to the public.
It's hard to say it because like, it's just like, okay, this is going to last forever. That's great.
Right.
I was already an extrovert in real life. Like, I'm a real extrovert, you know?
Yeah.
I need people. And when
Yeah.
I'm around people, I get more powerful.
Yeah.
Like, people are like, I'm a mix, because sometimes I need a break. I'm like, then don't want to be rude, but then you're not an extrovert. Like,
yeah, I know. It's really interesting, the whole introvert extrovert thing, because I see so many people kind of talking about being introverted now, because it's kind of like, I don't know, people are what they are. You should be comfortable being what you are. But I'm an extrovert, and it's a hard time to be an extrovert.
it is not. All my introvert friends that like, I'm like their only one friend, you know, and they see me like once a month. And like, I'm like, there are several of you, you know? I'm like, so how's the rise to power? I'm like, because I am dying.
Yeah.
Like, and I've stayed home from things. I just stayed home from a big conference, and there are another few big conferences coming up. And it's just like,
yeah,
it's horrifying in one hand, but also it's like, my kids are going to school. Like, how much longer do we need this to happen?
Right.
And part of why we stayed home is the nonprofit has been like funding childcare and like trying to help frontline workers. And we're like, well, probably if you add anything, that would be against the mission, like literally against the mission of the nonprofit, you know, like it's not just the divide of like your personal life anymore.
Right.
It's like,
it's hard. Yeah. And it's weird. It's a weird world where medical conferences are being canceled, which are huge conferences are being canceled. And yet all these other industries are having their conferences because they're like, well, we're vaccinated, we're doing this, we're doing that.
Or some of them have happened. Like, we've had medical conferences happen.
Yeah.
I talked to some friends who have telemedicine companies, and they're like, we didn't go because of the case upswing.
Yeah.
like that we see. And
Yeah.
but that was a horrific,
Yeah.
I just feel like it was a horrible decision. Like we're asking people to make all these horrible decisions.
Yeah. We're asking people too much.
Yeah, like you're asking people to do this stuff and it's like, well, do you want your business to grow, or do you
Yeah.
want to just be stuck in a hidey hole and, you know,
Right.
Jeff Bezos
Right.
is going to get richer. You
Yeah.
know, like,
And it's kind of the same structural dynamics come to play in all these situations where we know the people who are going to be able to, who are more able to take on that risk. It's the people who don't have young kids at home. It's the people who, whatever, don't have their own medical conditions, disability, whatever.
yeah. Well, suddenly
So,
it felt like, well, this is like a giant step back in career stuff, because
yeah,
I was talking to my friends who don't have kids and they're like, well, I can do things, like I'm not actually
Yeah.
putting people at risk.
right.
Um,
It's very different. I mean, it's a whole different world when you have kids and when you don't now. So it always is, but it's just everything with this pandemic widens existing disparities, I think. And you're just seeing more and more flavors of that with all this. So
do you think that's weird as like a physician? Like, because I feel like people haven't really talked about that, like physician burnout, and like,
yeah,
just, for a while people were super jazzed on talking about social determinants of health and how important it is.
right.
And then we kind of experience an actual crisis and realize that,
Yeah,
like, oh, sure, like we kind of care about parents, but like not really, just like take
Yeah.
care of your kids, you know?
right. Can we not have to deal with you and your kids?
We're like, tell you what,
Like the return to work stuff?
yeah, like, did anyone ever want to watch your kids? Because no, we didn't. Like, we didn't have those kids for a reason,
Yeah, I know.
like,
Yeah,
and
yeah,
I don't know. I feel like I'm able to talk about stuff like that easier than a lot of people, because it's like
yeah,
total autonomy parenting with one parent is a very different game. Like,
yeah.
it's very different. And like my expectations for life are different.
I like that you call it total autonomy.
I don't know what else to call it. Like,
That's spin.
what are you supposed to say? People are always like, well, it is like,
Yeah,
when
it is.
when
It
the
is.
other parent passes away, like,
Yeah,
yeah,
that's total autonomy.
it's total autonomy. Because
Yeah,
I was talking to someone about this today. Like, you know what? Like, nobody criticizes me.
yeah.
My kids do, but like
If I was gonna say about your kids.
no adults
Yeah,
nobody's like silently judging me for not folding my clothes the right way, although that might have gone the other way. But like, nobody's like, oh, you didn't cook enough for your kids.
right. Right.
We put a lot of negative energy on each other.
Yeah,
And when
definitely
you're doing everything alone, you don't have that anymore.
you don't have that. Yeah,
But I
Yeah.
wonder like how that translates to like physicians and medicine, are
yeah. I mean, my
are
mom
we
was
asking too much? Like, are we asking them to take on too much of our burden? As a society, I think the answer is obviously yes. But then I think also about like physician families, like, no offense, but like, I'm sure that they weren't like super happy.
Yeah. No, I mean, growing up, I have two brothers and we were raised by my single mother. So, and she's a doctor. So we kind of, she was still volunteering at the free clinic and doing all this stuff. So
The badass.
certainly inspirational in that way. But yeah, it's now during this pandemic, it's just, I don't know, you never worried about getting your kids sick in that way before, so
Right.
it's really different. And it's weird how much things have changed over a year and a half, and probably how much more they'll still change. I don't know.
Do you feel like your perspective about burnout has changed? Like about the
It
topic?
has. I think all this, it has built on it. I've built on it, meaning I think all those other things are still true. And I think that if you were to look at ICUs or hospitals or whatever across the country, I think you could probably look at some measures. We don't have this data, but you could probably look at measures of workplace climate.
Yeah, I mean, we could,
and
I mean, anecdotally, I guess.
yeah,
Yeah,
you
like,
could know that, right? Like, I think that you already knew. You could probably go back and predict the places that would have worse outcomes with COVID, higher turnover, whatever, all that stuff. I think you could probably predict that to a certain
really,
degree.
just based on how unhappy people already were.
Yeah, like it was already a bad place to work. It already was miserable. It already had poor leadership. It already had like fractured tension and all that stuff. But I think the difference is now is that back then, I was actually kind of against advocating for, let's say, an individual approach to burnout, meaning I was against saying like people should have therapy. I wasn't against therapy, but I was against like that as a.
So what I'm hearing is you hate therapy. Just kidding. No, I understand, because I feel like in the conversation, a lot of times they say, well, individual programs won't help. Like you can't yoga your way out of it. And I'm like, well, actually, like,
yeah,
can we just attack everything but yoga?
yeah,
Like,
yeah, I know. I mean, the thing is that it's true that none of those things, whether you're talking about wellness stuff like yoga, which I think whatever in that world can be really helpful to the right people, whatever, and then to actually therapy. Those, the way I think of it, because therapy has had a huge influence on me, a huge impact on me in this past year. I would say that therapy really cannot change anything about the broken systems and the shitty world that you are in, but it really lets you live in that world in a very different way. So I think it's essential now.
yeah,
I think it's essential now because
I always think about it from I think we all think about it from our own perspective. Like when John died, I feel like yoga and therapy like saved me, like
yeah,
I couldn't undo anything. And I felt like I don't know, it was like a response for myself that I didn't recognize. And like it was interesting because when you're drowning, it like you don't really give a shit about the ship.
yeah,
Be like, oh yeah, someday we need to have it all be better. You just need something to like keep
no, it's really
there.
bad. That's exactly it. And I think that's what changed with COVID is that people weren't in a leaky boat. They were underwater now, like overwhelmingly. A lot of people were probably already underwater, but now everyone was underwater. And it's kind of like, yes, this ship needs to be fixed and all that, but exactly like you said, we need to get out from under the water first. So that's like a critical thing that needs to happen right now. And I think that the mental health crisis we're in is people, not only is there so much stigma, especially from my colleagues, to seek help, but there's such a poor understanding of what it is. Everyone still thinks you go to a therapist to get advice. You're not getting advice from you. That's not.
I don't think it's everybody. Like, I don't know. I don't think it's just your colleagues. Like, I don't know if medicine is, well, I think medicine statistically is a little bit worse about mental health in some groups, but like.
It's a reflection of our whole society.
I think also about like how nobody wants things to be sad. They're like, just keep a positive attitude.
Yeah.
Like, or like, don't be toxic. And it's like, well, I actually don't think calling or, everything.
Just don't feel shame.
Happens for a reason. And like, you gotta see the good. And like, well, actually, like, do we have to see the good? Like, can we just let the bad be bad for once instead of like trying to have some kind of lesson from it? Like, let's just let it be bad.
Yeah. And how do we deal with that? Because you're not dealing with it if you're constantly feeling guilty that you're not seeing the good in things that are bad.
Right. You're like, oh, I'm letting this take up too much of my mind space.
Yeah.
Like, are you though? Maybe you're not. I'm good at this. Is why I'm like the anti-inspirational. They're like, don't let it take up your mind space. I'm like, hear me out. Maybe you do.
I think being reckoning with that and being honest with ourselves and each other is something that is very different now. And I think that in a good way, the tone of that conversation has changed. Where people are much more comfortable saying, yeah, no, things aren't okay right now. It's bad right now. So I think that's a big difference. I mean, for me, honestly, it's a combination of things that have pulled me out of this. And it's not all things that everyone can do, but the things I used to do for burnout on an individual level, like running and yoga and like baking and all that stuff, I still do those things, but those don't work. And I don't think those ever really worked to address the systems issues. So part of it has always got to be like
That's really
somehow
interesting
dealing with
what you just said, like
stuff.
they don't work.
Yeah, and the things they do work, but they don't work for fixing those things that are constantly like assaulting you, right? When you're in a place that when you go to a place to work and it makes you feel bad. Well, it doesn't, like, it can only do so much for that. It doesn't mean it's not necessary or healthy, but I think it's very different than when you go to a place where you see a lot of death. You know, it's not just a broken system and making you feel like you're not performing at your full abilities and all that. Now you're dealing with a lot of heavy stuff in a different way. And I think that's where I know for me, and I think for a lot of us over the past year, there's real intense feelings of being inadequate, not being good enough to save these people's lives. And that's where therapy really helped me, is to be able to say, it's easy to intellectually say, well, like, what else could we have done? But that doesn't really help when you kind of really feel like, well, you're remembering everything, right? So
It doesn't help you with the memories.
it doesn't help you with the memories.
How did therapy, I think that's interesting because accepting that people will all die is like a big part of kind of like my interest in like grief and death. It's like we're so ill-equipped to handle death.
Yeah.
And like physicians, you're fighting against it, like you're literally saving people's lives. So I think
a lot of it was this ability to be able to say that's happening to somebody else, and we're here to help them through this process. And then with COVID, suddenly you're seeing people that look like you, that look like your wife, that are like people that are younger, people that are this and that, people that look like your parents. And it's just as different, not just look like, but fit those demographics, fit the age group, whatever it was. You're just seeing so much of it, right? Where these people were otherwise healthy. And so you really, that artificial line of sick people and the healthcare workers that care for them, which is totally artificial, that line. But that line was like, you couldn't pretend it was there anymore. So
you're getting a page. I think it's harder to separate it from ourselves. I don't know. We should probably let you get back to work at some point. I don't know if I'm supposed to if we're supposed to do like inspirational questions, like what?
Well, listen, I can tell you this. I'll tell you that the things that really made a difference for me, if I were to give people advice, maybe I'm not really in the position to do that because it's a lot of privilege that goes into it.
Because it's like a YouTube channel. So like everything on here is fact.
Nice. I would say, because I think a lot of people out there are suffering right now. And I would say that the first thing is that you don't need to be having thoughts of self-harm to be sick enough to reach out to get connected with therapy or to find some kind of mental health resource. And I think that is the sort of tacit assumption that I had, was that when I reached that point that I'm thinking about hurting myself, that's where I need help. That's ridiculous. And it's how I think a lot of us are sort of trained to feel.
Dangerous a little.
It's really dangerous, but that's how we think of it, because those are the people we admit to the hospital, right? Oh, you had thoughts of self-harm. That's the line that was crossed. No, it's not like that at all. I think every single one of us should be speaking with someone. And I think for the most part, it is incredible the way it can unburden you and help you kind of really understand yourself. It has nothing to do with kind of giving you advice or it's really gives you a much stronger sense of self. I think it's so worth it, and you will not regret it. The second thing I would say is that for me, it was really hard to reconcile myself with the way that it affected my work, specifically as a doctor. And that's, for me, the way I address that is maybe a little ridiculous in that I created a card game about the ICU pre-COVID.
Awesome.
And that was my way of sort of sublimating it and saying, it wasn't working for me to like just escape into novels and whatever. It wasn't working. So I needed to do something that really like acknowledged and reconciled that the world of the ICU that I was a fellow in and training in to be, that I'm very passionate about, was really corrupted and changed. And I had to kind of reconcile that. And so what I did was I made this card game about the 2019 ICU. And it's not really idealistic. I don't think it's not all pretty. It's real, it's authentic, it's fun, I think, but it is
Medical schools can do it.
No COVID. Yeah.
No,
So
there's no COVID in it, huh?
no COVID. And that's why, to me, like just working on that sort of creative outlet that still sort of had the world of medicine in it and yet had nothing about COVID was so, I don't know how to say it. It's like a constant breath of fresh air. Every night I'm working on that. Every morning I'm thinking about it. And it is like an escape for me that is not an escape. And it lets me remember all the things I really care about and all the people I really care about that I work with. So I don't know what to say that other people could do for that, but if the work means a lot to you and that's why it's hurting you so much that it's like this, find a way to kind of reconcile that directly.
Yeah.
And I think the last thing I would say is that one of the things I did was that
it's harder than it's hard.
It's hard. It's really hard. It's really hard because this world in the ICU right now sucks compared to what it used to be like. And I wanted to go back. It's not going back. We still have this stuff, and it's even worse now that it's preventable, and we're still seeing people come in with this. So it's hard. It's scary. I wear an N95 all day once I walk out that door into the unit. So
nobody asked you to smile.
yeah, I know. I mean, it's not like all terrible. I'm not saying it's not like that at all. Not in Boston. It's not like that, but it's not.
I think about like the things that you're saying are like all things I've said, and it's like the things you say in therapy after you lose someone or after something happens that you just can't fix. Like,
yeah,
like people are like, it'll get better. And you're like, you don't understand. Like, it won't get better. Like the rest of my life, my kids will have like daddy-daughter dances. Like, and I will go dressed up in a matching outfit and it'll be weird. But
yeah,
when you want things to get better, I think that's really relatable. Like we want things to get better and they just aren't. And learning to deal with a different reality is very different.
It's very different. Yeah.
It's a different game than like finding your why again. It's like, what happens if you signed up for medicine and it turns out you all signed up for hospice care? Sorry, you know, you didn't know it, but this is palliative care for everyone. Like that's heavy. And that's a heavy thing to put on people. And that's kind of, actually, that's one of the reasons I wanted to talk to someone who had been in an ICU. Like, this is just not, the heaviness isn't something I understand. It's something.
Yeah, it's hard because you do the same thing for all these people where no one expected it. They're so sick. Their family members are exactly how any of us would be. The visitor policies keep people from coming in. It's heartbreaking. And every single time, it's just this like leaden dead weight that's like sitting in your chest, you know? I'm so happy that all the other stuff is still happening because other people are getting better now. Last year, other people weren't here and they weren't getting better. That makes a big difference. The people who come in with all the normal ICU problems, we're able to get them better, or we're able to get them comfortable in a good way. That's a good thing the ICU does. But this is different because it's a shock. It's unexpected. It's terrible. Every story is so catastrophic. Family is destroyed, you know, like it's terrible. And that's why I think the third piece of sort of advice I would have is it's okay if it's too much and you need to get out for a while or forever. I cut my time down.
For a while or forever.
I don't know. No, I mean like from
that's
work.
Valid. Yeah.
Yeah, it's okay. I mean, like I think I have a lot of colleagues who have cut. I'm one of the people who cut my ICU time down this past year. And I am trying to find like the place where it's really balanced and where I'm happy because I still love it. I still want to come here. And it is still really hard whenever I do. So it's a hard, I think maybe a lot of people will get this when I say when COVID is worse, you both feel like you have to be there and you want to be there and you sign up for the extra time and you hate yourself for doing it. You hate being there and you don't want to be there. You hate it when you're there. And it's just this bizarre situation where you're kind of like, I got to do this because this is what I do, but I hate doing this and I don't want this to be happening anymore. But as long as it's happening, I still feel compelled to do it. But other people, it's okay to not, that's not heroic to feel like that. It's just, everyone has to kind of do what they do and find the balance in their life that they need. And I think a lot of people are already doing that. And that introspection is having effects where on the one hand, yeah, I think we're seeing a lot of people leave. But on the other hand, I wrote a rec letter for a resident who was, born in the time of COVID, right? And they are so excited to go into ICU medicine. So it's a different, we're going to see both things. I hope people who play my card game Critical Care want to be here and do this work because the work is really rewarding. It's just right now it's also bad.
Yeah, there are a lot of things where being able to find a reward within a situation and still know it's bad is like, that's special.
Yeah, I'm able to do it, I think, because of the breathing room.
I'll tell everybody to get your game. Wait, can they actually buy it? Can you actually buy it now?
It's going to be on Kickstarter very soon.
This is exciting. Yeah. We can promote it. We can, talk about the sad story of COVID and then be like, but, it makes things better. Board game.
Yeah. Board games make things better. Yeah.
Yeah. Board games, like, can't beat things in your life. Maybe.
It's so anti-COVID. There's no COVID in it. It's a game that you play with other people in person. It's fun.
I like that. The extroverts need people.
I know.
Well, thank you for sharing that story. I'm going to stop recording.
Okay. Thank you for having me.